The officer told me. Okay. Good afternoon. Welcome to our Social Security seminar. My name is Stephanie Gates Edwards. I'm one of the benefits specialists in the Division of Pay and Benefits of the Human Capital Office. Glad you all could make it. Prior to me introducing our guest speaker, I have to go over some administrative notes. For those conferencing in over the telephone, please place your phones on mute to assist us with distractions throughout the presentation from the noise and feedback. We ask that you please hold your questions until the end of the presentation. At that time, the presenter will answer everybody's questions. Please speak directly into the microphones, and the microphones will be placed in the aisle so that the folks can hear you over the telephone if you speak directly into the microphones. Also, at the end of the service, at the end of the ceremony, would you please complete the survey questionnaire and hand it in to the employees at the table. For those on the telephone, if you have any questions or concerns, you may respond to the help desk at HR Center Help Desk, cms.hhs.gov. Again, that was HR Center Help Desk at cms.hhs.gov. So without any further delay, I would like to introduce you to our guest speaker, Ms. Tamika Christian, Public Affairs Specialist with SSA. Ms. Christian began her career with the Social Security Administration while she was enrolled at Coppin State University. Throughout her career with Social Security, she held many titles, such as teleservice representative, claims representative, technical expert, operations supervisor, and staff associate. This year marked 20 years of employment with Social Security Administration. So please join me in welcoming Ms. Tamika Christian.
Good afternoon, everyone. Thank you for that wonderful introduction. And welcome to our individuals that we have on the telephone, the ones that are at our regional office or at your regional offices and the field office. Today, I'm going to talk to you about some of the Social Security information. I believe everyone has a copy of the PowerPoint, and in the PowerPoint paperwork, it has all different websites and telephone numbers that I'm going to go over with you today. Also brought some fact sheets with you, and I left them out on the table: government pension offset, windfall elimination provision, and also how to create a Social Security account and the things that you can do online. Those fact sheets are available online also for the ones that are on the telephone. So today with the presentation, I'm going to tell you a little bit about the history of Social Security. I'm going to talk about the retirement program, disability program, Medicare, and my Social Security. So we're going to go ahead and get started with the presentation. The history of Social Security. In 1935 was our retirement program was established. In 1939 was our Survivors. Survivors program was set up to help the family members of loved ones. A lot of times during that time, it was the breadwinner maybe that passed away, so that their widow and children could receive some type of benefit when the breadwinner passed away. In 1956 was our disability insurance. And our disability insurance program is still one of the largest standing disability programs there are. Some employers don't offer long-term disability programs when a person goes out on disability, so they have to come to Social Security and apply, and this is one of the benefits that are available for individuals. In 1965 was our Medicare program, and Medicare was set up to help the elderly, people 65 and older, to have some type of health insurance, and also the ones that were disabled to have some type of health insurance. In 1972 was our supplemental security income. A lot of times you may hear us call that the SSI program. This is one of the programs that's actually not paid out of the FICA tax. This is paid out of general tax revenue, this program, because it is a needs-based program. 2003 was our Medicare prescription drug program. This was set up to help people to have some type of prescription drug coverage with their Medicare. And in 2010 was our Patient Protection and Affordable Care Act. This was set up to help individuals to have some type of health insurance if their employer did not offer them health insurance, or if they retired and didn't have health insurance once they retired. Saving for a secure future. Social Security is the foundation for your future, but it should not be your only means of future or only means of income. This website gives you some great insight on ways that you can save money for your future. And I'm going to show you this chart that actually shows you Social Security is just the foundation. You should have some other type of means when you're ready to retire. You should have some pensions, savings and investments, and some other type of income. Don't let Social Security be your only means for the future. It's just your foundation. What is My RA? My RA is a new retirement savings account set up by the Department of Treasury, and it's designed to help individuals to save for their retirement. And there's different ways that you can pay into this program, and I'm going to go over the 3 ways with you today. One way, you can have payroll deduction. You can go to your payroll, your human resources, give them a slip and set up for payroll deduction to have a little bit of money or how much you want to go into the My RA. Another way is you can do it through your federal tax return, where you can have money come straight from your federal taxes go into My RA. The third way is actually my favorite, a way that you can manage it yourself. You can set it up to come straight out of your checking or savings account. So set up so that you can have some type of way to save for a future. And this is if someone doesn't have a 401k, or if their employer doesn't offer them a retirement program, or let's say they don't have enough money out of their paycheck every month to pay into a retirement program with their employer, they can set up a My RA account and they can direct it the way they want to direct it. I do have palm cards, so at the end, if you like a palm card on that information, I will provide it to you. If not, there's the website also that's included in your handout. Who's currently receiving Social Security? About 60 million people are currently receiving benefit from Social Security. The bulk of the individuals are our retirees and their dependents. We have about 40 million retirees and about 3 million dependents that's currently receiving benefits. So who's currently paying for those individuals? We are. The workers of today currently pay for the beneficiaries of today. And that's how Social Security works. So when we go to retire, who's going to pay for us? The workers, whoever's working during that time, will be paying for our Social Security. The number of workers are currently decreasing. In 1960, it was about 5 workers to 1 beneficiary. In 2016, it's about 3 workers to 1 beneficiary. We're looking at about in 2035, it's going to be about 2 workers to 1 beneficiary. So we can see that it is decreasing over time. So this is where I'm going to talk about the solvency of the program. Each time I go out to an event, and I'm set up as a vendor at a table, someone always come and they ask me, will Social Security be around when it's time for me to retire? So I always include this when I come out to provide retirement seminars. As far as the solvency of the program is secure at this time. We are projecting that in 2034 that the benefits may decrease, and I'm going to give you an example of that. Let's say if a person is receiving $1,000 a month, if nothing is done to the trust fund between now and then, instead of that person receiving $1,000 a month in 2034, they may only receive about $790. So it's not that the trust fund will be zero, we won't pay out anything, but the benefit for the retirement disability could be reduced. There are many discussions being talked about to prevent this from happening, and we have great information on our website where we are discussing this, but we always wanted, that's why it's so important that we tell you that Social Security is just your foundation and not your only means for retirement. Cost of living adjustment. Throughout the years, there has been a cost of living adjustment given. This year, we did not have a cost of living adjustment. That means that if there is no cost of living adjustment, the benefit amount stays the same. But I'm going to show you an example where if there is a cost of living, how it really could affect and increase your benefits. Let's say a worker, average pre-retirement income is about $30,000. The worker decides that they're going to retire at their full retirement age in 2016, which is 66. The first year of their retirement, their pension from the employer is about $13,000, and their Social Security payment is about $13,000. So it's about 50% of their income, pension, and Social Security. If there's a cost of living increase of 3% each year, in 5 years, their Social Security retirement payment has gone up now to $14,632. Let's say if there's a 3% cost of living increase each year for 10 years. Now the Social Security payment has gone from $13,000 to $16,962. In 20 years, that payment has gone up to $22,796, which is now about 64% of their income. Because sometimes when you retire, your pension may not increase. Some employers does not offer cost of living. When you take your pension, sometimes you take it at that rate. How do you qualify for retirement benefits? In order to qualify for retirement benefits, you have to work and earn credits. One credit is worth $1,260. The max amount of credits that you can earn in a year is four. So if you earned already about $5,040, you've already earned your 4 quarters for this year. In order to qualify for Social Security, you need 40 quarters or at least 10 years of work where you've earned at least $5,040. One time I was out and a person asked me, well, what happens if I don't work? Can I just pay that $5,040 to get a credit or get my 4 credits? No. The only way that you're going to earn these credits are by working and paying into Social Security. Thinking of retirement. There's some great information that we have online when you're thinking about retiring. Some things you want to think about: will you have Medicare coverage or will you have health insurance once you retire? Also, have you checked your statement online? Do you know how much your payment will be when you retire? Are you going to continue to work after you retire? These are good questions that you can ask yourself. And again, we have great literature online that will answer these questions, and a lot of that literature I'm going to go over with you today. At your age, at the time you elect your retirement benefit, will affect how much your payment you'll receive. If you take your benefits at the early age, which is 62, you're going to get a lower payment. If you take your payment at your full retirement age, you'll receive 100% of your payment. If you wait until age 70, that percentage actually goes up. So I'm going to show you an example. If you were born between 1943 and 1954, if you take your benefits at 62, it's about 75%. However, if you wait until 66, it's 100%. If you decide that you want to wait until age 70, your payment actually goes up to 132%. That's how much you actually receive. In addition to the retirees, your family members can receive benefits while you're collecting your benefits. If you have a minor child under the age of 18, or if that minor child is age 18 and still in high school, they can receive benefits up until they graduate high school or reach age 19 and 2 months, whichever occurs first. If you have a disabled adult child that's not married, that's disabled before the age of 22, they can receive benefits off of your record also. If you have a spouse that's 62 and older, they can receive benefits off of your record. And if you have a spouse that's caring for a disabled adult child or a child under the age of 16, they can receive benefits also. So I'm going to give examples, and throughout my presentation, I will give examples. So let's say if a person is 66, they decide to take their retirement payment. They have a minor child that's 15, and they have a minor child that is 11. The minor child that's 15 does not live in their household, but the minor child that's 11 lives in their household. Not only will the retiree receive a payment, that child that's 15 can receive a payment, and the minor child that's 11 can receive a payment. And it does not affect the retiree's benefit, because when you pay into Social Security, you're paying into an insurance program that covers yourself and your family. It's like an umbrella. We cover you and your family. In addition to the retiree, the ex-spouse can receive benefits off of their record, and it does not affect the current spouse or the number holder or the retiree, I should say, benefit. If you were married to your ex-spouse at least 10 years or more, the ex-spouse is 62 and older, they can receive benefits off of your record. If you have been divorced from your ex-spouse for at least 2 years, they do not have to wait for you to apply. They can receive benefits off your record, and again, it does not affect you or your current spouse benefits. Deeming filed in question. Now, this is one of the 2 new laws that took effect this year, deeming filed and voluntary suspension. I'm going to go over both of these new rules with you. These are 2 new rules that took effect this year. What is the change in law for people who qualify for both Social Security retirement and spousal benefits? If you're eligible for both benefits as a retiree and as a spouse or divorced spouse, you must file for both benefits. This deeming filing used to only apply before the full retirement age, which is 66. Now, deeming filing will apply at any age if you reach age 62 after January 1st, 2016. Prior to the new rule, a person that was for retirement age could come in and they can decide if they want to apply for their retirement or if they want to take half of their spouse's payment as a spouse. With the new rule, if you turn 62 after January 1st, 2016, you don't have that option. When you come in to apply for retirement benefits, we will automatically see if you're eligible for a higher spousal payment. If so, then you would take your retirement program benefit and also that higher spousal payment. It doesn't give the person to elect which one they want to take first. Voluntary suspension. This is the second new rule. What is the change in law for voluntary suspending Social Security retirement benefits? If you take your retirement benefits, then acts on or after April 30th, 2016 to suspend it to earn delayed credits, your spouse or dependent, excluding your divorced spouse, generally won't be able to receive benefits on your Social Security record during the suspension. You also won't be able to receive benefits on anyone else's record during that time. So I'm going to give you an example of what used to occur. A person would turn 66, or their full retirement age, depending on what year they were born in. They would come into the office and they would apply for their retirement benefits. Then their spouse, and if they had minor children, they would receive benefits off of the record also. And then the retiree would say, well, I want to suspend mine, and I want to delay mine till age 70, but my spouse and children, I want them to continue to receive the payment. And they would continue to receive the payment. As the new law that happened April 30th, 2016, when you come in, if you decide that you want to suspend your payment as a retiree, everyone else on that record, your spouse and minor children, benefits will be suspended also. So that if you decide you want to delay yours, theirs will be suspended also. So these are 2 new laws that took effect this year. Spousal benefit computation. Benefits is usually about 50% of the worker's unreduced benefit. If you take spousal benefits before the full retirement age, your benefit will be reduced. Just like if you take your retirement benefit before your full retirement age, your benefits will be reduced. And here's a chart that actually shows you when your full retirement age is, because for each person, it could be different based on what year you were born in. How does Social Security determine your benefit? Your wages are adjusted for changes in wage level over time. So we look at your earnings and we adjust those earnings to bring them up to wage levels over time. And then we will find your monthly average of your highest 35 years of working. So we use your highest 35 years of working to determine what your payment amount will be. And some people will ask me, well, what happens if I only work for 20 years? Because sometimes, depending on where you work at, you can work for 20 years and then you can retire. Well, if you only work for 20 years, we're going to take those 20 years of earnings, but the rest of the 15 years will be zeros because we're going to use an average of 35 years to determine your average monthly benefit. And this gives you an example. It shows you that if a person before their retirement, they were earning about $5,500 a month. Once they retire or take their retirement, I should say, from Social Security, their Social Security payment is about $2,197. And this just gives you the chart of how we actually calculate that. This is available online if you want to actually calculate to see how much yours will be. You can do that online. But I just want to note also, if you see how a person before their retirement, they were making about $5,500 a month. Where now with Social Security, they're only going to receive about $2,197. That's why in the beginning I said it's only the foundation, because that's a big difference between $5,000 and $2,000 where your income could actually drop. You're going to need something in between there to fill in for that. Using the retirement estimator. This is a great tool that we have online where you can go online to estimate your benefit. You can do what-if scenarios. If I take my benefits at this amount, how much would I receive? If I wait until this time and I'm working, making this amount of money, how much would I receive? It's a great tool that I would encourage you. If you're thinking about retiring, you can always go online, play around with this tool, and it doesn't record what you're doing. It's just a tool so that you can estimate. My Social Security. How many people in the room actually have a My Social Security account by show of hands? Oh, great, great, great. Including myself, I have one also. It is a very great tool for you to use, and it's great information where you can go on there. And I'm going to tell you a little bit about the information that's on the My Social Security account. And in order to set up a My Social Security account, you have to be at least age 18, have a valid email address, a Social Security number, and a United States mailing address. And the things that you can do online, if you're not receiving benefits, you can actually go online to see how much your payment will be. We used to send the statement around, the Social Security statement. It's a white and green form. We usually send it around 3 months before your birthday. Well, at one point, we stopped sending it out due to budget, and we started sending them out again, but now we only send them out if you're going to be 25, 30, 35, 40, 45, 50, 55, 60, and after 60, we'll continue to send those out every year until your benefits actually start. But with this statement, you can actually go online and see the same thing that was on that statement. It shows you how much you'll receive at 62, at your full retirement age, and at age 70. If you're disabled, it gives you an estimate of what your disability amount will be. It lets you know what your survivors can receive off of your benefit. It also shows you your earnings throughout your work history. And that's one great thing about it. I go on there every year and I check my earnings. Even though I work for Social Security, I want to make sure my earnings are correct. And that's so important because when we calculate your retirement benefit, we're using your highest 35 years of working. So you want to make sure that your earnings are correct. So if you don't have an account, you may want to set up an account. If you do have an account, you want to go on there every year to make sure your earnings are correct. One new thing that just came to the My Social Security, if a person lives in certain states, the closest states to us is Pennsylvania and Washington, D.C. If you live in those two states, you can actually get a replacement Social Security card if you have a My Social Security account. You still would have to enter your identification information, and then the card is mailed to you, but it saves you a trip from going into the office. We don't have it yet in the state of Maryland. However, we are looking into that, trying to get it in the state of Maryland. If you are receiving benefits, the great thing that you can do online, because I know personally I like to take care of a lot of business online, and some people also like to do business online. So let's say if you're receiving benefits and you need a benefit verification letter, you can go into your My Social Security account and print that benefit letter. If you need a replacement Medicare card, you can go online and get that replacement Medicare card. Also, during tax season, a lot of people need a 1099. The 1099 is similar to our W-2 form. It gives you your earnings throughout the whole year that Social Security paid you. So if you were about to do your taxes and you need a replacement 1099, you can go online and get that 1099. You can change your address and your direct deposit information all online. So it's great tools available online with that My Social Security account. How to set up an account? You will go to our website and you'll click on Create an Account. And then we're going to ask you some personal information: your name, your date of birth, your social, your address, and telephone number. Once we get that information, then we're going to pull some questions, and we pull these questions from one of the 3 major credit bureaus. We use Experience. And just to let you know, it does not affect your credit report. It's known as a soft inquiry. But the reason that we pull these questions is because sometimes our family member and friends may know our personal information, and we don't want anyone else to open up an account in your name. So I'm going to give you some example of the questions that we may ask. You recently opened up a credit card in 2016. Was that credit card Macy's, Best Buy, Walmart, or none of the above? And you will answer that question based on if you did open up the account or if you didn't open up an account. Another question is, you recently financed your home in 2015. Did you use this mortgage company? And they'll give you a list of them or say none of the above. And we on purpose use these type of questions, again, so no one else can open up this account in your name, because they wouldn't know that much personal information about you as far as that information. Once you do that, then you will set up a username and a password. And once you set up your username and your password, you're ready to go. You have the option where you can add extra security. If you want a unique text message sent to you every time you log into that account, you can set that up at any time and stop it at any time. Windfall elimination provision. If any part of your pension is based on work not covered under Social Security, you may be affected by the windfall elimination provision. And this would affect some federal employees. If you did not pay into Social Security and you're like under civil service, when you go to apply for Social Security, you may fall under the windfall elimination provision. And with the windfall elimination provision, there is a different way that we calculate your benefits. So in the chart right here shows you if a person did not work, if a person paid into Social Security, they're under the normal computation. But if you have a person at some point in their employment did not pay into Social Security, federal employees, sometimes firefighters, sometimes police officers, where they don't pay into Social Security at some point in their career, then they do pay under Social Security. They could be under the windfall elimination provision. And it shows you when we calculate your benefits, instead of using 90% of your first $856, we're going to use 40% of the first $856. So if a person is under the windfall elimination provision, or if you were a federal employee that did not pay into Social Security during some of your career, when you look at your statement online with Social Security, that amount may not be correct, because we're not looking into the fact that you did not pay into Social Security at some point in your career. So what you want to do, we have a great calculator online where you can go in and calculate how much your benefits from Social Security may be, or you can always contact the office and we can give you that amount because we can do the calculation for you. And this gives you an example. For someone who has 30 years of Social Security coverage, we will use the regular formula. But it depends on how many years of coverage that you actually have substantial income under Social Security, depends on what formula we will use. And again, that windfall elimination calculator is online, and it's a very easy and great tool to use. Government pension offset. This is another one. If you receive a government pension based on work not covered under Social Security, your Social Security spouse or widow's benefits may be reduced based on the work based on when you did not pay into Social Security. And I have an example. The spousal benefits are usually reduced by 2/3 of the government pension will be used to reduce the Social Security spousal benefits. For example, $1,200 of your government pension, 2/3 of $1,200 is about $800. Let's say your spousal Social Security payment from Social Security will be about $750. Based on this computation, you won't be eligible for that $750 based on your government pension. We have this tool available online also, and it is the government pension calculator, which is online, that you can use. And this only applies if you worked and did not pay into Social Security, and then you want to draw spousal payments. This calculator you may have to use. And again, if you're using a calculator and you need assistance, you can go into the office and we will sit down and do the calculation and show you. But the tool is very easy online. I've used it multiple times, especially when I was processing a claim. I would show individuals the tool so they can do it also. When you're receiving retirement benefits, you can still work and receive your retirement benefit. However, you will be on an earnings limit if you're under your full retirement age. So if a person is under full retirement age, if they take their benefits at 62 or 63 or 64, they can work. They can make up to $15,720. If they earn more than that, then they will pay Social Security back $1 for every $2 they go over. The year that you reach your full retirement benefit, it goes up to $41,880. And the month that you obtain your full retirement age, there is no limit on your earnings. So an example for this, if let's say a person will be 66 this year, their birthday is in the month of November. They're still working and they want to collect their Social Security payment. They could continue to work and collect their payment. They would, from January up until October, as long as their earnings are not over the $41,880, they can receive their full Social Security payment and continue to work. And once the month of November comes, which is their full retirement month, there is no limit on their earnings. It doesn't matter what you make once you're full retirement. You can make $1 million and still collect your Social Security payment. A question I receive a lot of times, if I'm still working and I'm paying into Social Security, will my benefits increase although I'm receiving my payment? It could, because what happens is once a year we do a calculation and take into account those earnings that you're continually put into Social Security because you're working. And we automatically recalculate your benefit to see if you do a higher payment because you continue to work and pay into Social Security. How do you apply for retirement benefits? You can apply online, and this is the way that I would encourage individuals to apply online. The application is very user-friendly, and I put a copy of the application in just so that you can see how user-friendly it is. Each time you submit an application online, we review that application. A claims representative will review that application. We contact you sometimes, we'll call you or send you out a letter if there's any questions that we have about your application. Or if you don't want to complete the application online, you can always come into the office with an appointment or without an appointment. It could be a telephone appointment also, and you can call and schedule that appointment. I always note that on Wednesdays, our office closes at noon. So on Wednesdays, we're only open from 9 to noon. So if you're going to visit on a Wednesday, make sure you go in before noon. But you can always have a telephone appointment. You can call our 1-800 number, schedule an appointment. It could be a telephone or in office, whichever you prefer. Or you can always go into the office without an appointment and you will be seen. Applying for the retirement benefits. This is a screenshot of our website. We just redesigned our website, so I include this in here so everyone can see it. You can see where the red arrow is pointing. That's if you want to apply for retirement benefits. You click on that right there in order to take you through the application process. And this, I just included this as a screenshot just to show you how user-friendly it is. It just asks you basic information where you would just type in the information. It's very user-friendly. What do you need when you apply for retirement benefits? We're going to ask you for your social. We only need proof of birth if your date of birth is incorrect on our record. So if your date of birth is incorrect, then we may ask for your birth certificate. But as long as your date of birth is correct on our records, we're not going to need proof of that. We ask for your latest W-2 form or self-employment. And the reason that we ask for that is because sometimes we don't get all the earnings in until September. So let's say a person is applying for their retirement benefits in the month of July. We may not have those earnings for 2015 already. Because we want to incorporate that in your application, we may ask for your W-2 form or your self-employment tax return to include those earnings when we calculate your benefit, because it could be one of your high 35 years of working. We ask for an estimate if you're going to continue to work. At that point, we're going to ask for an estimate. How much do you think you're going to earn? We ask for your bank information because direct deposit is the safest and most convenient way of receiving your payment, and we like to always set up for direct deposit. We ask information about your marriage and your divorce. We're going to ask your spouse's name, their date of birth, and sometimes if you can't remember if you're ex-spouse, we ask questions, well, do you remember what age you were when you were married, and was the spouse older or younger, and sometimes that helps individuals to determine how old that spouse is. We ask the date you were married, the date you were divorced, the city and state, or even the country that you were married in and divorced in. And one of the funny stories when I was taking claims as a claims rep, one time I was taking an application for a gentleman, and I went on to ask his spouse's name and her date of birth, and he was providing me all the information, and I went down to ask the date of marriage, and he looked down at his watch, and he looked up at me, he said, Miss Christie, you won't believe today is my anniversary. He said, I thank you so much. So I said, oh, you're welcome, and I started laughing, wrote down, and he gave me the year they were married in. So he came back in because he wanted to set up for direct deposit, and he didn't bring in his direct deposit information, so he stopped by the office the next day, and he said, Miss Christian, I have to thank you again. He said, I would have forgot my anniversary. My wife would have killed me. He said, I didn't remember until you asked me during the interview, and we laughed so hard, and I said, well, I'm happy you remember. He said, me too. So it's just a funny story how you never know what impact it's going to have on you when you're taking a claim. We asked about your military information. A lot of the military information we have, as far as the date you enrolled and the date you were discharged. However, sometimes some people enroll and disenroll and enroll. We may ask for that if we don't have it. So we may ask for your DD-214 or your audible discharge, but a lot of times we already have that information. We'll ask for your railroad service information. And who can get survivor benefits? This is a topic that people don't like to talk about. However, it's a very important topic because if something should happen to you, you want to know what your family members may be eligible for if something happens to you. So just like in retirement benefits, your minor child can receive benefits off of your record if you pass away. And on your Social Security statement, it gives you that amount that that child can receive if something happens to you. If that child is disabled before the age of 22, they can receive benefits off of your record. Your widow or widower can receive benefits off of your record. Full benefits at full retirement age for a widow or widow. If a widow or widow take benefits early, the earliest that they can take benefits at age 60, it's at a reduced rate. If the widow or widower is disabled, they can take benefits as early as age 50. If you have a spouse that's caring for a child under the age of 16 or disabled, they can receive benefits off of your record if you pass away. And one question I receive a lot of times when I was a teleservice rep, a lot of times people will call in on a 1-800 number and say, I'm receiving widow's benefits, but I'm thinking about remarrying. How will this affect my benefits? As a widow or widow, if you remarry after the age of 60, it does not affect your benefit. As a disabled widow or widow, if you remarry after the age of 50, it does not affect your benefit. So you can continue to receive those benefits although you remarry. And I'm going to give another example because, as I said earlier, I like examples. Let's say if something happens to me, and I have a child that's 32 that's disabled, but my child was disabled before the age of 22. They were disabled from birth. If something happens to me, that disabled adult child can receive benefits off my record, although I have passed away, because they were disabled before the age of 22. Just like in a retirement case, let's say you're receiving benefits, you apply at 66. You have a child that's 40 years old, but that child was disabled from birth. When you apply for your retirement benefits, they're going to ask you, do you have any adult children that was disabled before the age of 22? If you say yes and list that child's name, then we're going to contact that person to take an application to receive benefits off your record, and it does not affect your benefits at all. widow or widow's benefit computation. At full retirement age, they receive about 100% of the deceased worker's unreduced benefit. If they take the benefit at reduced at age 60, they'll receive about 71.5% of the benefits. Reduced benefits on one record at age 60, reduced or unreduced benefits on other records at age 62 or older. Social Security's definition of disability. So now I'm going to talk about the Social Security's disability program, and I'm going to give you Social Security's definition of disabled. A medical condition or combination of impairments, it could be physical or mental, preventing substantial work for at least 12 months or expected to result in death. The determination also considers age, education, and work experience. So when we go in to determine if you're disabled, we look at the condition. Not only do we look at the condition, we look at your age, education, and work experience, because all that would impact the decision. Who can receive disability benefits? The worker must pay into Social Security 5 out the last 10 years. So we're going to look at that 10 years of your work history from when you became disabled. Out of those 10 years, if you have 5 years of working, you could qualify for disability benefits. For people that's under the age of 31 that's disabled, less work is required, and I'm going to give you an example of that. And it shows you right here. If you're under age 31, you must pay in the Social Security taxes for half the time since age 21. And the reason that we do this for individuals that's under 31 is because they may not have the same work experience as someone that's 40 years old. Especially if a person becomes disabled at age 24. Let's say they graduate from college, they started working and they are in a car accident, and now they're disabled at the age of 24. You may not have that much work history as someone at age 40. So if a person is 24 and they become disabled, they need at least 1.5 years of work experience working to be eligible for disability. While you're receiving disability benefits, your children can receive benefits off your record also, just like in retirement. Your child that's under the age of 18 or 18 still in high school up until age 19 and 2 months or graduates. The child that's not married, disabled before the age of 22. Your spouse, 62 and older, or if that spouse is caring for a child under the age of 16 or a disabled child, they can receive benefits off your record. Divorced spouse may qualify for benefits also. So as I stated earlier, Social Security is basically an insurance or umbrella program. It covers you and your family. And one great thing about this is each payment is paid separate. It's not one lump sum check. Each payment is paid separate. So let's say you're receiving disability benefits and you are divorced. You have a spouse, but the spouse has the children in their care majority of the time. So you can receive a payment, your disability payment, and that ex-spouse can receive payments for the minor children for each minor child, and each payment will be paid separately for each child. So it covers you and your family members, although they're outside of your household. Applying online for disability. Social Security offers an online applications for adults to apply for disability. It's the most convenient way, and we made sure that this application was online, because a lot of times if you're dealing with a disability, you may not feel like coming into an office, or you just may not have the time, because a lot of your doctor's appointments are usually during business hours, so you may not be able to come into the office. So we made sure that this application is online where you can apply for those benefits, and you can go in the application and come out and go back in if needed. You have to be age 18 and older to apply online, have a medical condition or combination that prevents you from working for at least 12 months or more, or result in death, reside in the United States or one of its territories or commonwealths. And this is where the application is located on our website. As I stated earlier, because our website was just redesigned, I printed this out to make sure everyone can have a copy, because it's very user-friendly, and you can see where the red box is checking for the disability application online. There are 3 parts to our disability application online. The first part is actually the disability application, where it asks you questions: your name, your date of birth, if you're married, your spouse's name, their date of birth, if you have children. The online disability part, which is the second part, this asks you about the medical information. They're going to ask, what is your condition? What medication are you on? What doctors are you seeing? We're going to ask for the doctor's name and their address. If you had any inpatient or if you had an emergency room visits, we're going to ask for the hospital and their address. We're going to ask if you had any procedures or tests, lab work, x-rays, CAT scans. We ask for all that information. Then we're going to ask about your work experience. The last 15 years of your work experience, what actually have you been doing as far as work experience? Because we look into that. The last part of the actual application is where you would actually go on, fill out or sign the medical release form. You can sign the medical release form online. You can do the whole application online. So what is the medical release form? That's the form where you're going to sign where we can get your medical records from the doctors that you provided to us, because we don't want you to have to get those medical records. A lot of individuals, some come in with their medical records or they'll mail them in saying that they got a copy each time they went to the doctors. But we don't encourage that you have to get those, because sometimes depending on your doctor or what hospital you were seen at, sometimes they may charge you for that. And we can get that information. So as long as you sign this medical release form, we can obtain those medical records and you don't have to do it. Your benefits may be taxable. Some individuals that's receiving retirement and disability benefits, about 40% of the people who's currently receiving the retirement or disability benefits are currently paying taxes on their benefits. In our booklet, we have a retirement booklet, or you can actually go online and look at that booklet. It gives you a good chart to show you, based on your other substantial income, if you would have to pay taxes on your retirement or disability. Each year we send around a 1099 statement, and that 1099 statement would actually show if you had taxes withheld. If you request taxes to be withheld, we use the tax form W4V. You can have taxes collected at the rate of 7%, 10%, 15%, or 25%. We only withhold federal taxes. You can change that at any time. So let's say if you start receiving Social Security benefits at 66, you're still working full time, and you decide, well, I'm going to take 25% out, withholding every month for Social Security. And let's say you file your taxes and you realize, I didn't need 25% withheld. I'm going to drop that down to 7%. You can come into the office, or you can download the form online and change that at any time. You don't have to wait for the beginning or end of the year to change that, or you can stop it at any time. Now I'm going to talk about Medicare. Who can receive Medicare? If you're 65 and older, if you're receiving disability for 24 months, you may be eligible for Medicare. If you have ALS, also known as Lou Gehrig's disease, if you have permanent kidney failure or receiving dialysis or kidney transplant, you can receive Medicare. If a person has been exposed to environment health hazards, they can receive Medicare. For these three that's listed at the bottom with these medical conditions, you almost can receive Medicare immediately, where there is no wait time. Once you apply for that application, we automatically process that almost immediately. When can you enroll for Medicare Part B? There are 3 enrollment periods for Medicare Part B. Your initial enrollment, that's when you turn 65. You can enroll 3 months before your 65th birthday, the month of your 65th birthday, or 3 months after your 65th birthday. That's your initial enrollment. There's a special enrollment. Special enrollment period, if someone is working and they don't take Part B because they're working and they're covered under their group health insurance, they can decide not to take Part B at that time, and before they retire, they can take the Part B, or they have up until 8 months after they retire to take the Part B. That also would cover your spouse also. Let's say you're working, your spouse is covered under your group health insurance under current employment status. Your spouse is eligible for Part B, but they don't take the Part B because they have group health insurance with their current employer. They don't have to take the Part B. They can enroll during special enrollment. They can enroll at any time that they want the Part B, or they can wait until you retire and they can take the Part B. General enrollment period. General enrollment period is each year, January, February, and March. You can enroll during that time. But the Medicare would not begin until July. So I'm going to give you an example of general enrollment period. Let's say someone is 65, their birthday is in the month of January. They're 65. They don't take the Medicare Part B because they're good health. They don't see a doctor. They walk 5 miles a day. They're doing really good. And they say, well, I can't afford to pay for that Part B because Part B does cost, the standard premium is $121.80. But let's say they can't afford that and they decide, I don't want to take Part B, I'll just take Medicare Part A. So one day while they're out walking, let's say they're 67 now, one day they're out walking and they trip and fall. And now they have to see a doctor on a regular basis. But they did all this in the month of July. We're in the month of July. So they did that in July. They're 67. They'll be 68 in January. So they need to see a doctor. They can see a doctor, but they won't have the Medicare Part B. They can't enroll into the Medicare Part B until January, February, or March. So that January, they go into the office and they enroll in the Part B. But the Part B won't begin until that July. So it'll be almost a year before they can enroll in the Part B from when their incident happened. With the general enrollment period, there is a premium, or could be a subcharge premium, of 10% for each 12 months that they didn't have it. So an example I gave, it was about 3 years that that person didn't take Part B. So they will have about a 30% subcharge on top of the $121.80 that they may have to pay. So those are the 3 enrollment periods for Medicare Part B. Medicare has 4 parts. We have Part A, which is your hospitalization, helps to pay for your inpatient care in a hospital. Medicare Part B is your doctor visit. It covers about 80% of all approved doctor visits. About 20% you'll have to pay. And the standard premium, again, is the $121.80. Medicare Part C is your Medicare Advantage plan. These are health plans offered by Medicare-approved providers, insurance companies. When you join Medicare Advantage plan, you can get the benefits and services covered under Part A, B, and most Parts D. Medicare Part D is your prescription drug program. It covers a majority of your portion of your prescription drug costs, your out-of-pocket costs, monthly premiums, annual deductibles, and prescription co-pays. They can vary by plan. Social Security doesn't handle Part C and Part D. We can't enroll you or disenroll you in those. There are private insurance companies that you can join on your own. Medicare has some great information on their website, and I listed them also where you can get information about these companies, but we actually don't enroll or disenroll. We handle Part A and Part B. We do help with the extra help. So I'm going to explain what the extra help with prescription drug is. Extra help is available for beneficiaries with limited income and resources to help pay for the cost, monthly premiums, annual deductibles, and prescription co-payments related to a Medicare prescription drug cost. The estimated worth is about $4,000 a year. So let's say a person has Medicare Part A, they have Medicare Part B. They enrolled in a prescription drug program, but they want help to pay for their prescription drug program. They can contact Social Security. It's available on our website, or they can come into the office, and we can do an application for the extra help, which will be worth about $4,000 that Social Security can help pay for those prescription drugs for that person with their co-pays. And as I stated, you can actually apply online. This application is online, or you can contact us by phone or come into the office to apply for this extra help with the prescription drug program. Medicare savings programs. This helps to pay for the Medicare Part B premium, that $121.80. Some individuals may not be able to afford to pay for that. So there are plans, and they're usually through Department of Social Services, that can help with those plans to pay for that monthly premium for you so that a person doesn't have to pay for that out of pocket. And I provided Medicare's website and telephone number. I always include that when I'm doing a retirement because they have great information on there for Medicare. The Affordable Care Act. President Obama signed the Affordable Care Act into law March 23, 2010. The key parts of the Affordable Care Act took effect on January 1, 2014. Every plan will offer comprehensive coverage from doctor visits to medication to hospital visits. If your employer doesn't offer health insurance, you can buy health insurance directly at the marketplace available, and I provided the website I also provided their telephone number, so if you have any questions, you can contact a rep and talk to a rep. But what I also included was their website. So a lot of people ask me, Tamika, why do you include this in your seminar? What does this have to do with Social Security? Well, I'm going to give you 2 examples. Let's say a person retires at age 62. You can't get Medicare until you're 65, and not all employers, when you separate from employer, offer you health insurance once you separate. So if that person retires at 62 from their employer doesn't offer health insurance, and they can't get the health insurance Medicare until 65, from 62 to 65, that person may not have health insurance. So they can always go to the marketplace and they can look at health insurance that will be affordable to them that they could pay for until Medicare starts. The second example that I give is if a person's disabled. Let's say the person turns 35. They're getting Social Security disability. But when they stop working for the employer, because again, all employers do not offer health insurance when you start working with them, that person didn't have health insurance and they're disabled. They're receiving disability, but the Medicare won't start to 24 months from their date of entitlement. So that's about 2 years that that person may not have health insurance. They can always go to the marketplace and they can purchase health insurance that they can afford, that their doctors will accept, that will be within their price bracket, so they can still be seen by a doctor until their Medicare starts in 24 months. So that's why I always include it, because it is individuals that don't have health insurance, or the employer, once you retire, may not offer them health insurance, and maybe they want to retire early and don't want to wait till 65. Last thing that I included was our information on social media, because social media is very important, and a lot of people like to go online. We have a Facebook, a Twitter. We also have a YouTube with blogs, and we have very great information, online where you can get information. Sometimes we have webinars that you can look at that tells you all about Social Security. So I wanted to make sure I include that, especially if you're a social media person, because we have great information on our website and on our Facebook. So this actually concludes my actual presentation. I'll open it up for questions, and I think you have to come over to the mic, that if you have questions, come over to the mic, because they want to make sure that the people over the phone can hear you.
On the slide, you can work and still receive benefits. For people who are independent contractors or that sort of thing, they have a Schedule C business form. Does the $15,720 gross?
Yes.
Okay.
It's gross.
Okay, thanks.
You're welcome.
Hi. My question is, if I choose to retire at 62 under the first program, and I want to also claim survivor's benefits, my husband's survivor benefits at 62, first question, will that offset my Social Security benefits? Second question is, if I claim his survivor benefits at 62, then when my benefits are at full benefit is 62, can I transfer over to my benefits?
Yes. The answer to the first question is, if you decide that you want to take survivor benefits at 62, as a widow or widower, you can do that, and it does not affect your benefit. When you become your full retirement age, or even if you want to wait till age 70, you can collect your benefits and receive the full amount.
Yes.
Also, I know that we have people by telephone, so Danielle, do you have any questions for people that's on the phone?
I do so now. Your lines are unmuted. Again, if you have any questions at this time, you may do so. Your lines are unmuted at this time, and we are accepting questions on the phone lines.
I have a question. If you're collecting disability benefits, what happens when you hit retirement age?
Okay, that's a good question. If you're receiving Social Security disability benefits, once you reach your full retirement age, nothing actually happens. The actual title switch, so it will go from disability to retirement, but the benefit amount will remain the same.
At that point, could you take benefits on your spouse's number and collect more money?
Yes.
Thank you.
You're welcome.
Yes, one more question.
Uh-huh.
If you are, the day you turn 66, and you've worked for the government for 30 some odd years, and you decide you still want to continue to work and earn your salary, I understand you can draw your full Social Security benefit and earn your salary?
Yes, if you're full retirement age. It depends on
Right.
what.
If the full retirement age happens to be 66,
Yes.
and you are 66. Not 62 or 63, and then I know the last one is 70, so this is the 66 year that we're talking about.
Yes.
Now, does Social Security take the taxes out for you, or do you pay that directly? How does that work?
You can request for federal taxes to be withheld. You would actually tell us, I want federal taxes withheld. We don't withhold any state taxes, just federal, and it will again be at the rate of 7, 10, 15, or 25%. And you can change that at any time.
How soon do your benefits begin once you file? When do they start coming to you?
It depends on when you file. If you're for example, if you're 66 in July, July payment is paid in August, so you'll get your payment in August based on your date of birth. So we pay the benefits now on either second Wednesday, third Wednesday, or the fourth Wednesday of the month. So it depends on what date your birthday falls on. You'll probably get your first payment if your birthday is in July, in August, depending on, it could be the second Wednesday, third Wednesday, or fourth Wednesday.
And your spouse is, say, 56 years old at that time. How does this affect their benefits? Again, you're drawing your full benefits, say you die. How much of that will the spouse get on that day if the spouse is only, say, 57 and not at retirement age?
They won't receive anything if they're not at retirement age.
Okay,
However, if they decide to file at 62, they could be eligible for a spousal payment. It would be reduced because it's before their full retirement age. However, if something should happen to them and they become a widow, they can still draw benefits off your record at age 60, because you took your benefits at full retirement, won't reduce theirs. They'll still have a reduction because they're taking it earlier, but they're still eligible for benefits.
Okay, thank you.
You're welcome. We have a question in the room, Danielle, so I'm going to take this one real quick.
Okay, I'm in the government, in the CSRS offset program. So I understand I will get a government pension and I will get Social Security. And I will have a portion of my pension offset by my Social Security based on the amount of time that I'm in the CSRS offset program. My question is, my spouse is full CSRS and is not eligible for Social Security under the government pension offset. Would her pension, her survivor benefit on my pension, be the amount that is reduced by Social Security, or would it be the full amount of my government pension?
Okay. I don't know if your government pension will be reduced for widows. That's probably a question to ask for the civil service to see if hers will be reduced. I can't answer it because I don't know the reduction for them.
Do you have any contacts at OPM that might have that information?
I don't have it with me. I may have it at the office of OPM rep. I'll have to look and see at my database, but I don't have any offhand, no.
Okay, I'll see you afterward.
Okay.
I'll give you an email. Thank you.
Okay. Danielle, if you had any other calls on the line, we can take it now.
If there are any other questions on the line, please do so. Your lines are unmuted. Again, if you have any other questions for those who are calling in on the phone lines, you may do so at this time. Your lines are unmuted.
Yes, I have one question based on the new rules, because you said once you turn 66, if you suspend your payment, then your spouse will not be able to receive Social Security also. So if I suspend my payment to 70, can my spouse claim her Social Security at 66, and then when I collect my payment at 70, she get half of my benefits that way, if mine is more than what she's getting at 66?
Okay, let me make sure I understood your question. You're saying if you take your payments at 66, your spouse wouldn't be eligible to receive anything?
No, if I apply at 66 and I spend it until 70, can my spouse claim hers at 66, and then when I get 70 and claim my payments, can she then claim half of my benefits if it's more than what she's getting?
She can. The reason for that is because you haven't filed. If you haven't filed, then she can't collect any benefits off your record as a spouse. So if your spouse waits until she's 66 and take her full payment, and then you decide to take yours at 70, when you file, then she can be eligible for half of yours if it's more than hers.
Okay, thank you.
You're welcome. I have a question in the room, so I'm going to go ahead and take that one.
Hi, I have a question about Medicare Part B. You said that at age 65, when we sign up, we're paying $121.80 per month. What if we're still working and paying for commercial health insurance, and we're at the age 65? Do we still have to pay that in addition to the $120-some for Medicare Part B?
Okay, so basically you could be under special enrollment. That means if you're still working and you have group health insurance with your current employer, you don't have to take the Part B because you already have group health insurance and you're already paying for that. You can hold off and taking that Part B until you're ready to retire, and then you can enroll in the Part B where you won't be paying double.
Okay, thank you.
So you don't have to take it at 65 if you're still working with group health insurance. And that's one thing I want to say is make sure that you're covered under group health insurance, because I've seen situations where a person, let's say a spouse retire and they have group health insurance, and like when we retire, we can take our health insurance with us. Then they go back to work, but their group health insurance is not with their current employer, it's with their retired employer. So if they try to enroll in Medicare, they may not go under special enrollment because it's not under current employment status. So make sure it's under current employment status. Yes, sir. I have a question in the room.
Yes, I'm a FERS employee. I have 34 years still working. My wife just turned 65, and I have to disagree with your answer previously. HR here has told me that even though I'm in the Federal Employee Health Benefits program as a couple, not family this year, but as a couple, I still had to apply for Medicare Part B. And for some reason, which I disagree with, we have to pay that premium. And my carrier, Aetna, refuses to pay a premium until they get the Medicare notice of benefit.
Oh, wow. Thank you for that information. I guess some insurance companies will do that, but most of them haven't done that. But it's up to the discretion of the insurance company. So as he said, his insurance company as a federal employee, Aetna, makes him enroll in Part B, where Social Security doesn't make you enroll in the Part B, but his insurance company did. So did you get a notice from them when you when your wife was reaching 65 saying that you had to enroll in Part B?
No.
Well, how did you know?
Because she goes to the doctor, and we get a notification from the carrier, from Aetna, saying they're refusing to pay until we send a notification from Medicare as to what they're paying.
Oh, wow. So that's great information. Thank you. I haven't came across.
And then I called HR here, and they told me that that's acceptable.
Oh, okay. That's the decision of the insurance company. So that's something that you may want to do when you're reaching 65. Check with your insurance company to find out if you have to enroll in Medicare, because Social Security doesn't say that you have to enroll, but your insurance company may say you need to enroll. Any other questions on the phone, Danielle?
If there are any other questions on the phone line at this time, please do so. Your lines are unmuted. Again, if there are any questions over the phone lines, you may do so at this time. Your lines are unmuted.
Okay, since there's no questions on the phone, we have one in the room, so I'm going to go ahead and take that question.
Okay, my question is, if I take Social Security at 62, and my husband waits to take his until he's 66, and then something happens to him, am I given the option of taking whichever is higher, his Social Security or mine?
Yes.
Okay.
Yes,
Thanks.
you have that option because you're considered, if something happens to them, you're considered a widow. So as a widow, you can receive that higher benefit from your spouse,
Even if I started collecting early?
even if you start collecting that early, yes.
Okay.
Any other questions in the room? And Danielle, can you open the lines up one more time?
The lines are all unmuted. Is there any questions?
Okay, if there's no other questions, this will conclude our presentation today. Thank you so much.